found some calcifications, and they wanted to do some extra imaging. So I guess I just wanted to know, since I've already had so much radiation, if this is going to be a lot more, and if it will really be causing a lot more damage, and just kind of what that means.
Okay, sure, I'm happy to talk about that with you. I understand you have a history of breast cancer in the other breast, in the right breast.
Mm-hmm.
Did you have radiation with that?
Mm-hmm.
Okay, so you had surgery, radiation.
Mm-hmm.
And so what we're seeing today are a group of calcifications that weren't there on your last mammogram.
Mm-hmm.
So what we usually do, and you may remember this from the last time you had a workup, is anytime we see them on a screening exam, which is just 2 views for us to get an overall look at the breast. Anytime we see an abnormality, we ask for additional views. In particular, the ones we're looking for today are magnification views.
Okay.
And the reason is these calcifications are so small that it's hard for us to see on the big global view of the breast what the margins of the calcifications look like, if they're irregular or if they're smooth and rounded, how many there actually are, because we tend to see more when we, more detailed, smaller calcifications when we do the magnification views.
Okay.
So without those, it kind of, on our end, is like an incomplete workup.
Mm-hmm.
And so it's harder for us to determine, are these benign, are these something that we can leave alone, versus are these potentially cancer, potentially malignant, and something that we need to biopsy.
Right.
So we can't make that determination without that information. So I just kind of want you to understand why those views are important to us. It's not just a reflex, let's get more imaging, because we don't know what it is. It really is, we can't tell what those are without those additional views.
Okay.
So having said that, I know you're concerned about like the level of radiation that you're having. And did you have like a month of radiation with your last breast cancer? You went in every single day and had treatments. So that dose that you had was, more in the therapeutic range, and that's actually designed to destroy tissue, destroy cells, destroy any remaining cancer that would have been left behind by your surgery.
Okay.
The kind of radiation that you get with a mammogram is very minimal. It's, a fraction of, what you're getting from background radiation, from any kind of radiation treatment dose that you're having. And so I know it's hard to understand if you don't have like absolute numbers.
Right.
So when we make comparisons, we sometimes say that, an x-ray is equivalent to, or let's say, it would take 300 to 400 x-rays to be the equivalent of a CT scan.
Okay.
And a CT scan is kind of the equivalent of flying across the country one time, going from like Boston to California.
Mm-hmm.
That amount of radiation that you get from cosmic, from space,
Mm-hmm.
is about what a CT scan is.
Okay.
And so if you think about a 400th of that, that's probably what a mammogram amounts to.
Oh, okay. Okay.
Does that help?
No, yeah, it does. I wasn't sure if it was the same type of you said the word magnify, so I didn't know if that meant that, it was, going to be getting like a more concentrated dose of radiation. I was just kind of, worried about that, whereas I already had so much,
Mm-hmm.
I didn't know of like any of the effects that it would have. So, I definitely, want to get that looked at,
Okay.
just to make sure that.
Yeah, especially because at such a young age, having a history of breast cancer, that we have to be really careful with you, and we have to watch really carefully. And so we're always weighing the risks and benefits, especially in medical imaging. We don't want to expose people to radiation if we don't need to.
Okay.
But I think that you're a high-risk patient because of your history, because of how young you are, that we're going to do a lot more good by working this up and finding out what this is.
Mm-hmm.
And we just can't say one way or another without those views. So if you're on board, I would like to do those.
Yeah, thank you so much for explaining it. It's just, I was hoping that there was going to be nothing there, and then it was just thrown off a little bit. But
yeah, it's always surprising when you get unexpected news, especially when your like personal experience frames that, when you see something on a mammogram, it can lead to something really bad. So you know, we'll get the additional views, we'll see what the calcifications look like, and if there's something characteristically benign about them, we may be able to write them off. You know, if they're a little bit indeterminate, probably do a follow-up, and if there's anything concerning, then we would probably go ahead with a biopsy.
Okay.
But yeah, I'd rather be safe than sorry.
Absolutely, yeah, I agree.
How do you feel about the plan?
No, that sounds good. I'd rather be safe than sorry too. So thank you for explaining it to me.
Sure. Do you have any other questions for me about radiation or about, you know, breast cancer or calcifications or anything?
No, not right now. No.
Okay.
If they do come up, though,
I'm sure they'll come up as soon as I leave the room, right?
That's how it always happens, right?
Yeah. Well, if you do have any other questions, just ask the reception. They can come back and grab me. I'm happy to talk to you a little bit more if, you know, anything else comes up. And I'll come back and speak with you once we get those magnification views, and we can go from there.
Awesome. Thank you very
Okay.
much.
Very nice to meet you.
Nice to meet you too.
All
Thank
right.
you.
We'll see you in a bit.
Yes.
You have 2 minutes remaining for the encounter. Time, please. Residents, please return to the write-up area to complete your paperwork. time, please. Residents, please return to the write-up area to complete your paperwork.